In this video, we're going to show you our denture workflow for a pretty typical case that we see in our clinic here, which is transitioning a patient with immediate dentures into a 2-implant mandibular overdenture. So the first part of this sequence is going to be the treatment planning phase. And that first appointment will be, of course, the comprehensive exam, where you're going to gather all the patient data. So here you're going to be intaking patient chief complaint, medical history, hard and soft tissue findings, as well as mounting their casts when able. So with the chief complaint, you really want to hone in on their desires and expectations and see if that's something that we can meet in our clinic here. Medical history is important because we're going to be doing fairly extensive surgery as we're removing all the remaining teeth. And the hard and soft tissue findings are needed to really justify the removal of all the patient's remaining teeth. So once that's completed, the next step will be treatment planning the case with the pros faculty. And before you meet with us, it's a good idea to enter in the codes and sequence them appropriately. The other thing you want to be thinking about is which teeth to leave as a posterior stop. So we like to select a pair of opposing posterior teeth to leave to help maintain the vertical dimension, as well as it helps in mounting the casts when you get to that phase. The other thing you want to think about too is, are there other surgical procedures that may be needed outside of extractions? So this can include tori removal, alveoloplasty, or even soft tissue grafting around future implant sites. So once that's done, then the surgical consult would be the next step. And here you'll meet with the surgical faculty to go over the patient's medical and surgical complexity. So here they'll decide if there's any procedures that may need to be referred out. The other thing you'll do is just confirm the sequence of extractions to make sure that the number of extractions is appropriate at each visit that is scheduled. Once that's done, the treatment planning presentations appointment can be made, where you'll present all of this to the patient, go over costs and sequence and approximate time frame. Here you also want to discuss the expectations, especially during the healing phase, as removing all the teeth and then putting them in this immediate denture can be a fairly challenging process. The other thing you do want to mention is any future maintenance costs that may be associated with maintaining the 2-implant overdenture, as there's certain parts that we do recommend to be replaced over time. Most of the time, appointments 2 and 3 can be scheduled on the same day if you're able to get ahead and schedule efficiently. So we'll move on to the pre-prosthetic phase, which involves posterior extractions. And we like to take out the posterior teeth first and get some initial healing, because you tend to be able to border mold those areas a little bit better, and it makes for a better fitting immediate denture. And generally what we do is select one side of the mouth to do at a time. So for example, we'll select the right side first, and then you'll remove the posterior teeth on that side, so upper and lower. And then you'll want to wait about 1 or 2 weeks for just initial healing and patient comfort before you start extracting teeth on the opposite side. So if you can schedule that within a week or 2 of each other, you can combine that post-op step. So once the posterior teeth are extracted and we've gotten some initial healing, we do want to wait about 3 to 4 weeks for at least primary closure of those sockets before you start doing the preliminary impression. So once the sites have healed, then you'll walk through your denture steps. So first we start off with our preliminary impression, and from there we can make custom trays. Don't forget to block out and put wax over the teeth to provide a little spacing and make room for impression material in that area. So next is the final impression, where you'll border mold and make your PVS impression. And once that's done, you can send this to the lab to Wyan to have it poured and have your rims made. If you choose to do that, that's about 4 business days from the make it. If you choose it to do it yourself, obviously you can shorten that time frame if you're trying to expedite the case. After that will be occlusal rims, and once that clinical appointment's done, you'll send it back to the lab where they'll set the teeth for the next appointment, which is the wax try-in. You'll confirm that the patient is happy with the occlusal plane and the occlusion looks good. And once that's squared away, you can get that processed and it's ready for delivery. So here I've listed the approximate lab times that line would need to complete each step here. And at the delivery appointment, this is where you'll remove the remaining teeth in the patient's mouth, and then you're going to deliver the denture. Once that's done, that leads us to the post-extraction phase, and you'll schedule a 24-hour denture adjustment in PROS. And at this point, you're going to be just removing major sore spots in the area. There's a combination of things that cause discomfort. One, just normal healing from taking out all the remaining teeth, and also the denture may be rubbing in certain areas. After that will be your 1-week adjustment visits. So the first one you'll schedule will be in the surgery clinic, and you want to use the code post-op for that. And then for the 1-week denture adjustment, you want to schedule that in PROS, and then again use the adjust codes. So put the appropriate codes for the correct sequence. That really helps the front desk differentiate between the PROS and surgical clinics. So the adjust codes for PROS and then post-op for surgery. Once the sites have healed and you get primary closure, then we can do a soft reline procedure. So this is coded as tissue conditioning. And here the gums and bone will have remodeled and shrunk over time. So the soft reline really helps to snug up that denture and then make that denture a lot more comfortable for the patient. We also want you to schedule a couple of additional sets of tissue conditionings, and these can be treatment planned and charged out as needed. So over time, and each patient will heal a little differently, so it's nice to have a couple extra time points in which we can redo this reline procedure as the bone and tissue continue to shrink over time. So that rounds out the immediate denture sequence, and we'll jump into planning the 2-implant overdenture. So you want to wait about 10 to 12 weeks for healing to allow for bone to fill into those extraction sockets. Once that occurs, we can schedule the CBCT appointment. So here you're going to follow the dual scan protocol, which means that you need to schedule 2 different appointments, one in radiology for the CBCT, and then the other needs to be charged out as an implant measurement, which you'll schedule in PROS. So the dual scan protocol entails 2 different scans. And before you do those scans, you want to put these radio opaque stickers pretty evenly distributed on the denture. And you want to vary the vertical placement of them so that they're not all in a straight line. And what this does is it has common data points that we can then merge in the 2 scans. So the first scan will be with the patient wearing this denture with the markers in place. And then the second scan will be with the denture just on its own, so that when you import the scans into the software, you can see the common data points that allows us to align those 2 images together. And then from there, you can plan the implant placement. The other thing that you'll want to remember to do too is to get a radiographic order, and it'll be the 6th one on the list, so labeled CBCT order doctor. And then when you get to prompt number 7, you do want to choose the dual scan protocol, fully edentulous. So make sure that box is checked off. One thing to consider too and evaluate is when you do this dual scan protocol, the denture does need to be fairly well fitting. So if the denture needs a soft reline to really snug up the denture and make it stable, plan to do that before you get your CBCT scan. So once you've gathered all that data, the next step is to plan out your implant placement, as well as to design and fabricate the surgical guide. So there's an instructional video that will link below here that'll walk you through the 3Shape software to accomplish all that. So here's just a little screenshot here. And at this point too, based on the planning, if there's any hard or soft tissue grafting that may need to occur, to get the implants placed. You'll discuss that with the surgeon. And once you've walked through that process, there is an implant surgery approval form that does need to be filled out. So there's 4 total signatures that you'll need. Both pros and surgical faculty will need to approve the implant position. And then Darcy will take a look at your surgical guide design and make sure that that looks correct. And then Benita will be checking off that all the forms and treatment plans have been signed. So once you've obtained all those signatures, then you can take that to the front desk and then they can schedule your implant surgery. So once that's squared away, then we can actually schedule the implant surgery. And this will be charged out as the endosteal implant. And you'll need 2 of those for the 2 implants and then a alveoloplasty code if necessary. So sometimes we elect to reduce some of the height of bone. So for 2 reasons. One, to gain enough prosthetic space. And then sometimes that's also necessary to get to a width of bone buccolingually that's wide enough to place the implants. So if that alveoloplasty and bone reduction is fairly extensive, then we'll also choose to do a soft reline so that the denture can be better fitting. So when you remove all that bone, obviously that ridge height has shrunk and you want to snug up that denture again to allow for a better fitting denture during the healing process. You'll have a 1-week post-op scheduled in the surgical clinic. And then from there, it's 3 to 4 months for osseointegration. And that allows time for the bone to grow onto the implant and stabilize that implant into the bone. At 3 to 4 months after, a second stage uncovery surgery can be scheduled where the implants will be uncovered and healing abutments will be placed. And sometimes, not very often, there's times where the healing abutments really interfere with denture and an additional reline may be needed to make that denture fit. And then we'll leave it up to the surgeon depending on how that second stage surgery went. Sometimes a additional post-op visit is needed. If not, you can just wait until the preliminary impression to take a look at the soft tissue healing. So this leads us to the prosthetic phase, where we're going to follow the same sequence of steps as a conventional denture. So first will be the preliminary impression, and at this visit you'll be charging out for the maxillary complete denture, the mandibular overdenture, as well as the 2 locator abutments, which are coded as prefabricated abutments. The other thing you'll do at this visit is measure the tissue height for each implant so that we can have the appropriate locator height available for you when you do your final impression. So once the preliminary impression is made, you'll be fabricating your custom trays. So that leads us into making the final impression for our overdenture. So a couple extra steps that you'll need to make during this appointment is the seating of the locator abutments. Another difference too is that you're going to be placing these locator impression copings that snap onto the locators. So those will be picked up inside the impression. So you could see that there's some undercut features within that coping that allow it to be embedded into the impression material. Once that impression material is set and it's removed from the mouth, you can see in that third photo that we're going to be inserting these locator analogs into the impression so that when it's poured up, the master cast is going to be a representation of what we see in the mouth with the locators sticking up just above the gum line. So the important thing to note here is when you're fabricating your custom trays, because we need to make room for those impression copings, you do want to add some additional wax and foil onto the areas of the healing abutments that you've picked up. And that allows for room for those locators to be not interfering with the tray when you're making that impression. Another thing to note is we have to give the lab some additional time, and that's because when we make these mandibular overdentures, we are going to ask for a cast metal framework to help strengthen the denture, since that metal housing and the locators eat up some of our prosthetic space. So Wind would need 12 business days to get that back for us. The rest of the appointments will be fairly similar to a conventional denture. So occlusal rims, then the lab will set the teeth, then you'll do the wax try-in, and it'll be ready for processing. And then appointment number 10 will be their delivery appointment. So a 24-hour adjustment visit can be made, and you can work out any sore spots as needed. For some reason, if the locator impression was not captured accurately, then the metal housing will not be processed within the denture. So if this were to occur, it's at the 24-hour adjustment period that you would attach the metal housing onto the inside of the denture. So that allows for the denture to snap in to the implants. A 1-week adjustment can be scheduled where you adjust any further sore spots that you may still have. And this leads us into the maintenance phase. So what's typical is that we ask the patient to come back once a year where we can clean the denture as well as take x-rays of these implants to track the bone levels and to make sure that everything is healthy. One of the things you also want to tell the patient too, other than the prophy and x-ray visit, are these other codes that may be required as things tend to wear. So one of the routine maintenance procedures that may need to be done is the replacement of the nylon housings. So that's charged out as needed, but about once a year is recommended. So that code is D6091. Another code is the implant maintenance procedure, and that's to be completed if the actual metal housing that's embedded inside the denture ever gets dislodged. We would need to replace that and then re-pick it up chair side in the mouth. So the gold locators themselves can wear, as you can see in the photograph on the right. So even if you end up changing out the nylon housings, the denture still may not be retentive because the abutment actually needs to be replaced. So generally about 5 to 7 years we can quote the patient before replacement, and that will be charged out as a prefabricated abutment, which is D6056. Here's a chart showing all the maintenance codes and the current costs that you can show the patient. So all these codes can be entered into a maintenance folder in the treatment plan, and you would just charge those out as needed. But this at least provides the patient with some idea of general maintenance costs over time. So this last slide is a summary of the denture workflow sequence. And here you can see the costs associated at each visit. So this is helpful when explaining to the patient at what time period the bulk of these costs will be required. If you were to break it up, the first phase is the immediate denture, and that runs about $2,000 for the prosthetic. And you have to, of course, add on the surgery costs associated with that particular patient. And then the definitive phase, the upper denture and then 2 implant overdenture is about $5,300. So this sheet is just helpful for you guys to wrap your head around the whole sequence and the time frame, as well as you can give the patient some ballpark costs when you're presenting the plan as to how much they're going to owe throughout the procedures. So now I'll show you on Axium a few things to make your life a little bit easier. If you go to the patient name and you type in denture example, I have a fake patient here that we've made where things are already sequenced and treatment planned. So if you click on the accepted folder, you can see in the max mandibular immediate complete denture will be labeled in the control folder. These appointments are sequenced the way that we want you to sequence them for your own cases. So that first phase of treatment will be the extractions, posterior extractions on the right side, and then post-op extractions on the opposite side. And then healing time, about 3-4 weeks for primary closure. And then you can start with the preliminary impression, and this is where you're you'll charge out for the immediate dentures, final impression, rims, wax try-in, and then the delivery appointment is where you're going to be taking out the remaining teeth, including hopefully one posterior stop that you've left. From there, you'll do your 24-hour adjustment in pros. This will be your 1 week post-op in surgery, and this will be your 1 week adjustment in pros. We've also asked you to put in 3 different sets of tissue conditioning codes, and then you charge those out as needed. And you can add an adjustment code at the end, just in case you need an extra visit for an adjustment. Now jumping into the maxillary denture and then the 2 implant overdenture, you can see that we have the CT scan, the dual scan as a first appointment. You'll place the implant and possibly do an alveoloplasty, tissue conditioning if needed, post-op. You'll do your second stage recovery after 3 to 4 months of osseointegration, tissue conditioning if needed. This post-op appointment can be done if the surgeon finds it necessary. And then at the preliminary impression, you'll be charging out for the upper denture, lower 2 implant overdenture, and then these are your locator abutments that you'll be charging out as well. And it follows the same sequence: final impression, occlusal rims, wax try-in, delivery, and then your 24-hour 1 week post-op. And again, if you need to pick up the metal housings, that's going to occur at this 24-hour post-op here. So the other folder to look at is this maintenance folder. And here we have the codes entered in for the possible maintenance visits and procedures that the patient would need. So this is your yearly cleaning as well as the 2 x-rays that you'll be taking. This is the replacement of the nylon, so those inserts that come in and out, and that's about once a year. Implant maintenance will be charged out when the metal housings need to be reattached to the inside of the denture, and then about maybe 5 to 7 years, if those gold locators start to get worn, you'll charge out a prefabricated abutment for those cases. So the next thing I'll show you are the multi-codes that will help your treatment planning be a little bit more efficient. So for immediate dentures and complete dentures, you can click on the arch that you are interested in, and if you go to add procedures, hit on the categories, multi-codes, and for this example we'll just show you a maxillary immediate denture. So you can see the M dot code here for the immediate denture. Click on that and that will populate in the treatment planner. So you can take all of these codes and then make a new case. So we can label this control phase, max immediate denture. If you're also doing the mandibular denture, I would also do that for the lower, and then you'll have both codes inputted into this folder. And then from here you can just click and drag into new appointments to separate out each procedure for the appropriate appointment. So prelim impression and the immediate denture, those are charged out in the first visit, so I'll leave that in visit 1, but you can go down the line and then start to make new visits for each subsequent procedure that you have. So next would be final impression, after that would be occlusal rims, and then so on and so forth until you get it ordered in the same way that we have shown you in our template example here. Of course, you're going to need to go in and add in the appropriate extraction codes if you're doing the immediate denture. So be mindful of that as you're punching in all these codes. So the one difference for the mandibular overdenture multi-code is you got to click on the teeth numbers that you want to place the implants in. So when you go to view categories, multi-codes, we do have a code for the 2 implant overdenture. So go ahead and click on the multi-code for mandibular 2 implant overdenture, M.overdent, and this will populate in the treatment planner. And then you can see that it has all the pertinent codes, including the CT, as well as it's going to label the implant second stage prefab abutment for the tooth number that you selected. So if you had selected 2227, it'll have all those codes available for you. So you can go ahead and match up the sequence here to, again, what we have as a template for you in this folder here. So hopefully that's helpful to make things a little bit more efficient. So really utilize those multi-codes to save you some time from clicking and waiting for Axium to load everything.